Hello, I'm Sandosh, and I'm joined by Isabel and Risa, and this is our poster on neonatal mortality. Asian Americans, Native Hawaiians, and Pacific Islanders have, on average, the lowest neonatal mortality rate in the United States compared to other races and ethnicities, including but not limited to non-Hispanic whites, Hispanics, African Americans, and multiracial persons. However, aggregation of Asian Americans and Pacific Islanders may hide subgroup level disparities. Furthermore, although there have been multiple California-only studies that have disaggregated Asian Americans and Pacific Islanders, there has never been a national-level study. As a result, our objective is to trend and compare neonatal mortality, which can be defined as mortality that occurs after birth but before 28 days among Asian American and Pacific Islander groups to non-Hispanic whites.
Our approach to our observational cross-sectional study is highlighted in the method schematic below. We use data from the National Vital Statistics System, or NVSS, from 2015 to 2019. NVSS is a national database that provides neonatal mortality data using cohort-linked birth and death certificates. We identified 36,166 neonatal deaths among close to 11.5 million births, including Asian Americans, Pacific Islanders, and non-Hispanic whites. Based on prior literature, we then identified neonatal and maternal risk factors related to neonatal mortality. Maternal risk factors were related to socioeconomic status, health conditions, behaviors, and delivery. We then calculated crude neonatal mortality rates and performed trend analysis between 2015 and 2016 to 2018 and 2019. For our results, among Asian American, Native Hawaiian, and Pacific Islanders, there was an increase in neonatal mortality rates among Filipinos, Japanese, Koreans, Native Hawaiians, Samoans, and other Pacific Islander neonates.
We also calculated the average current neonatal mortality rates from the 2015 to 2019 data set and analyzed by race. And on the graph below, we see a blue bar, and that is the non-Hispanic whites, which is our reference group. And here we want to highlight the disparity amongst the Asian American groups with regards to the neonatal mortality rates. So for example, the neonatal mortality rate for Samoans is 5.7, which is 3.4 times higher than Chinese, who have mortality rates of 1.7. And 5 Asian American groups had higher neonatal mortality rates than non-Hispanic whites. In terms of the limitations of our research, we did not include neonates with missing birth or death certificates, and we also did not include mixed race neonates, so that limited our data sample. As for next steps, we aim to calculate adjusted neonatal mortality rates by risk factors using a multivariate regression. And we will group risk factors of interest by 3 groups. So the first is social-demographic factors, the second is clinical risk factors, and the third is birth weight and gestational age. And the 3 groups will be iteratively added to the multivariate model in order. So this is the end of our presentation. Thank you so much for listening.